We are such a large city. We are bound by freeways and cars, and everybody's trying to get from location to location. So just by being an urban environment, we already kind of have some things inherently, kind of working against us. So we do have to create opportunities for people to increase their physical activity and eat healthier. But if you're in a big city and you through supply and demand, you can't have a grocery store or a food market on every corner, then it forces people to have to make a decision. When they get home and they get in their neighborhood and there's no place to food shop, they're probably going to go with a fast food option. Diabetes is, to me, not like any other disease, because sometimes when you go and you're told that you have diabetes, you may just be given like a diabetic diet, just on a sheet of paper. But what does that mean? How does my eating impact my blood sugar level? The Dawn Center is really an opportunity for the City of Houston to impact people who are either pre-diabetic or living with diabetes or are caring for someone that's living with diabetes. The idea for Dawn was for Dawn to really be able to be a behavioral kind of complement to the healthcare or physician provider. We have what we call a reciprocal referral agreement. And so if a physician or any other clinical provider diagnose someone with diabetes, they then refer them to us for those behavioral things like nutrition and physical activity, stress management. Because of the burden of diabetes, a physician may not have time to talk with you about that. And that's the great thing about some of the services that we offer at Dawn, to educate and to make people aware that when you're a diabetic, you can live with diabetes quite successfully, but it requires not only clinical support, but education. The great thing about Dawn is that the cooking classes are very diverse. We have to offer cooking classes and demonstrations where the Dawn member can get a hands-on experience with making meals that are diabetic friendly, making meals that are culturally relevant. Sometimes when they are diabetic and they're wondering where they could go and for example, work out or get their fitness and improve their fitness levels. And so the Dawn Center exercise classes offers that. And so our Dawn mobile unit is an excellent way to get out into the community and not just be at one location. And we can still offer some of the services that we offer at the Dawn Center. Guidance about your diabetes. We can actually do screening, of course. So we're able to do the diabetes risk assessment. We can also do cooking. We can also do education. The lives that we've impacted, the number of people that now know that they are indeed pre-diabetic, the number of people who are diabetic and now know that it's not just the clinical piece of managing their diabetes, I think that makes it a success. Certainly we have helped people to lower their A1C. That to me is a quantifiable success. We've also given people an awareness of their A1C. Cities Changing Diabetes has been, over the last 3 years, a real wake-up call that we can do something about diabetes in urban communities. And through the research, through the knowledge that we've gained working in Houston, we have to implement it, we have to refine it, put out what doesn't work, keep what works, but keep going. So I do believe that we can change our communities. I've seen it happen.